Hi everyone, today we are talking with Dr. Judy Morgan about a potentially toxic bacteria that is present in bodies of water across the country that can be fatal to dogs. Dr. Judy Morgan is an integrated veterinarian who is now retired from clinical practice. She is an internationally renowned speaker and also the best-selling author of 4 books on pet wellness and nutrition. And we are lucky enough to have her joining us today to discuss this very important topic. So Dr. Judy, when you are ready, please join us. Dr. Judy is an amazing veterinarian that I've been following for quite a long time, and I'm really excited to have her participate in our conversation today about harmful algae blooms, which are actually bacteria. And so Dr. Judy is going to be telling us all about this momentarily. Here she comes. Hi, how are you?
Well, apparently I'm now updated.
Yes, fantastic. Hey, listen, sometimes it takes multiple tries, but I'm really happy that you stuck it through. And welcome to your first Instagram Live.
Yeah, Facebook Live, I'm all over that, but Instagram, never done this.
I know, I see how many followers you have on a regular basis on your Facebook Lives. I'm actually one of them. I've been following your career for a very long time, so it is an honor to actually have this conversation with you. So thank you so much for joining us. Yeah. So I was just explaining to our followers and our viewers about harmful algae blooms and how they have a potentially toxic bacteria. And most people aren't realizing that this is actually on the rise. So I'm hoping before we get into the details of the symptoms and the signs and what people can do if their dog is exposed, can you talk to us a little bit about what they are? What is cyanobacteria? What do we need to worry about?
Well, it's basically excessive growth of a blue-green algae. And there's no way to know for sure if the pond or lake or backyard pond that your pet is swimming in has this in there. Sometimes you can see something that looks suspicious and sometimes you can't. Things that you might look for. It's interesting. I found I think it was out of California. No, this one's actually out of New Jersey. There's a great website. It's a state website that talks about the HABs, which are the harmful algae blooms. And they have really good pictures on the website. So they describe it. It can look like large green dots, which are basically little, blobs of the algae growing on top of the water. It can look like those green streaks. And I've seen this so many times, green streaks of algae kind of going through the water. It's kind of when you walk through it, it's like slimy and sticks to you. They have a description called spilled paint, where it looks like it's kind of swirled through. And then they have another one where they just call it pea soup. So it's just the water looks kind of green and gooey. And it can be confused with other kinds of algae or duckweed, other types of plant growth. But the problem is you can't really tell just by looking at it. It may have a bad odor. A lot of times these dying because there's so many algae, and they grow when it's really hot and humid, and that's what causes them to bloom. So certainly, this summer so far, I'm in North Carolina now. It's hot, it's humid, and you drive by a pond or a lake and you can just kind of see they look a little scummy. It's not always green. It can actually look red, reddish brown, sometimes even white.
Yeah, I've heard white when the blooms are like starting to die, that they actually change on a different color.
Yeah, so you may not be able to tell that that's what's going on there. Me personally, I grew up in southern New Jersey, and my mom was determined that my sister and I would learn how to swim, but we didn't belong to a pool, and so we learned how to swim and not very well, in lakes. And in southern New Jersey, we have a lot of cedar lakes because of the pine barrens. So the water is always brown, and it sticks to you, and it's just disgusting. And the bottom of the lakes is all like slimy, gooey. So I never wanted to touch the bottom, and I didn't want to swim in this stuff anyway, because when you get out, you're like covered in this brown goo. So I have an aversion to lakes and ponds anyway. I would have an aversion to taking my dog swimming in these lakes and ponds. First of all, we've got snapping turtles, we have poisonous snakes,
Right.
and we've got poisonous algae. So it's a little bit scary, but if I was the owner of Labradors that are swimming dogs and love to, chase things in the water, I understand why, the dogs love it so much. I understand why people would want to allow their dogs to go swimming and throw the sticks out there for them to go chase. But it is a little bit risky, particularly if you see this algae covering on the water. It might be a safe algae, but it may not.
Yeah, and I know there are a lot of scientists that are going out there trying to test bodies of water to determine if they do have the harmful cyanobacteria, and then if that cyanobacteria has the toxins present. But we can't just rely on our government to go out there and put out signs and do that testing for us. So I very much agree with you that you really want to take the precautions and be preventative in every way, shape, and form, because as far as my understanding, and this is something that I would love for you to talk about, if your dog is exposed to cyanobacteria and the toxins are present, the chances of survival are extremely slim.
Well, yeah. It depends on exposure, how quickly you realize they've been exposed, because unfortunately the symptoms may not be immediately apparent. It could take 48 to 72 hours for you to realize that your pet was exposed and that they're suffering with the side effects of the toxins. And there are 3 different toxins, so the symptoms can be wildly different depending on which one of the toxins was present, or 2 toxins, or all 3. Right. So
and when you say there are 3, you mean the toxins being the liver, the nerve, and the skin toxins, correct? Or
there's a neurotoxin, a kidney toxin, and a liver toxin.
Oh, okay. I didn't know about that. Okay. Fantastic.
Yeah, so there's microcystin, which is the liver toxin, cylindrospermopsin, which is the kidney toxin, and then anatoxin A is the neurotoxin.
So even I learned something. I didn't know about the kidney toxin. That's even more scary. And I have to tell all of our viewers, I had my dogs off leash at a park that we've gone to. This was several years back, and this was my first exposure to cyanobacteria. And it was in November. And so where I live up in Rhode Island, it was very cool. And so we had already had our first freeze. And so I thought it was okay. And they went in the water and they came out, and I started freaking out because I saw a sign that said that it was still present. And what I can tell you is, thank God I had towels, and thank God I had fresh water, and I had the state of mind to rinse them off, dry them off, prevent them from licking. Thank God they didn't drink any of the water. But to your point, my dogs will never be going into a body of water again. Like, seriously, it's just not worth it. And that I think I lost my heart that day because I thought I literally killed my dogs. But so how can dogs be exposed besides, obviously drinking the water? What else do we have to think about?
Well, drinking, but also swimming in the water. It's going to be on their fur. And so what do dogs do when they come out of the water? They go run and lay down somewhere, and then they start cleaning everything off and licking, so they can ingest it that way as well. And it's certainly through any of the mucous membranes, through the eyes, the mouth. So we have to be really concerned. And to this point, I can tell you that I lost one of my dogs to drinking pond water that was filled with algae. I don't know that it was an HAB, but he bloated. So we were doing our spring yard cleanup, and we had a koi pond, and the koi pond had been turned off, so it had algae on it. And all day long, he was just dying to get back to that pond and drink the water. It was a warm day, and I kept yelling at him and chasing him away from the pond. And then a few hours later, he went into a bloat. He's a big Doberman. And we actually lost him to the bloat from the pond water. So this toxic water, and could it have been that there was HAB there as well that contributed to him forming that bloat? I don't know. But this is why so we're talking about, let's not take our dogs to swim in these ponds and lakes where there might be a problem, and there may or may not be signs posted. If you see a pond or a lake that has all that algae growth on it, you're actually supposed to report it to the states. so that they can go out and test it and post signs if need be, because certainly they can't be at every pond and lake throughout the states. But even just drinking that water that had so much algae, and I'm sure had a lot of bacteria and stuff, and it was enough to cause a bloat for my dog. So think about backyard ponds as well as, you know, going to parks and lakes and that sort of thing.
I'm so sorry for your loss. That is so traumatic and awful. So let's say that a pet parent has their dog and they go into a pond and they didn't realize, and they see the sign afterwards like I did, but they weren't lucky enough that it had been a first freeze. And so the algae is present and the toxin is present, though they wouldn't know that obviously by looking at it. So we're going to make the assumptions that it is always. What are some of the first steps that they should take if they think exposure has happened to their pet?
So certainly getting them washed off as quickly as possible, toweled off even, you know, if you got a t-shirt on, rip it off and wipe the dog off. And then getting them to a veterinary clinic if possible. And actually what they would do is they would induce vomiting, which you could do at home. You can use hydrogen peroxide to induce vomiting, but it's recommended, the veterinary recommendations are to induce vomiting and then to give activated charcoal to try to decrease the absorption of the toxins. But those sorts of steps really need to be within the first hour or so. So you really need to, if you think that your dog was exposed to this sort of an algae bloom and they were drinking the water like my guy was, and you saw it happen, you really need to jump on that, like jump in your car and get to the emergency service, which right now is a little tricky because I'm getting a lot of people that are reporting to me that a lot of the emergency services are on diversion. They're sending people elsewhere because they're all so incredibly
inundated. Yeah.
Breaks my heart. Breaks my heart. I'm not in practice anymore, but it breaks my heart that people are being turned away.
Yeah, absolutely. I think, you know, it's a great idea is if you think that your dog's been exposed, get in your car, make a phone call, or have someone that's with you make a phone call and just let them know you're coming and what you think has happened, because maybe they can put you as a priority on their list as an emergency, because as you have mentioned, it could be something that can happen right away, or the symptoms may not start until 72 hours later. But I would assume the faster you can jump on it and get fluids into the system and try to flush things, then maybe the chances of your dog surviving are going to be greater.
Right. Because if you wait 3 days for treatment and they're in acute kidney failure and there's been enough kidney damage, you're not going to get them back. But if you are proactive on day one and say, well, he's not symptomatic yet, but he might be tomorrow, he might be the day after, I'm going to go ahead and start treating this dog right now, your chances of getting them through that are much better. So
what type of treatment do they do? Is it I mean, I would assume, like, again, I've never heard about the kidney toxin, which I'm fascinated by, and I want to go do more research on. I know with the liver toxins, they do a lot of liver support. Sometimes they use milk thistle or the other veterinary prescribed one. But what else do they do?
Yeah, so for the liver one, is besides getting them to vomit and then giving them activated charcoal if you get to it soon enough, there's actually drugs that they can use. It says oral cholestyramine has been effective up to 7 days post-exposure, so that's a good one. Cyclosporin A, rifampin, and intravenous silibinin, which is basically milk thistle, can be helpful, and then just supportive therapy. So you're trying to keep nutrients in these animals so that they, because they will become very hypoglycemic if they have the liver toxin, because the liver is responsible for gluconeogenesis, which is basically making the food for the cells of the body. So the blood sugar will drop dramatically. So, you know, maybe being on an IV drip with glucose if needed. And then, you know, keeping some sort of parenteral nutrition in these dogs. And as far as the kidney disease, it really is what we would use for acute kidney failure of any type. Again, nutritional support. If they're not eating or not able to eat, then it might be IV nutrition, IV fluids, B vitamins. It's really just supportive care to try to get them through it.
And could a pet parent expect that the dog would be staying at the veterinary hospital for days while treatment is occurring?
Yes. And particularly with the neurotoxins, these animals may be having repetitive seizures. They might be comatose. They could end up being on a ventilator. And so you're kind of waiting to see whether this neurotoxin is going to wear off, whether you're going to be able to get ahead of it. So it's not something where you could keep your animal at home and kind of deal with it. It really would be frankly, a critical care hospitalization. So it's not even something, if your general practice doesn't have people there overnight and they're not well versed in critical care, then I would say having them at a 24-hour critical care center is going to be your best hope.
I have to say that on a personal note, one of my friends, and she's a customer of mine because I have a pet shop here in Rhode Island as well. She actually lost her dog recently to cyanobacteria, the toxins. And, I kind of want to dedicate this to her because I really want for other pet parents to know this is not a joke. This is not something to be taken lightly. She was just locally over the state in Connecticut, thought everything was fine. She actually works at a vet's office. So she was actually more in tune with what's going on than most. And one of the things that I think is so interesting is that veterinarians and scientists are still learning what cyanobacteria, what the toxins are capable of. They actually got her dog through for 2 weeks, and then she suddenly died of under cardiac arrest because of the stress that the body had been put through. So there's so many other potentials that can happen that I just really want to implore upon all of our viewers to please take Dr. Judy's advice. Just stay away from the water. If there's any hesitation in your mind, any doubt that there may or may not be, if there's a bad smell, if you see foam, if you see something slimy, take precautions and just maybe get in your car and take them and, put a hose on them or a sprinkler or something to that effect. I really appreciate you being here. For anyone that isn't familiar with Dr. Judy Morgan, she is a veterinarian that I have been following for many, many years as a clinical pet nutritionist. I have learned so much from her. Please go look at her website, www.drjudymorgan.com, and go buy her books. They're best-selling for a reason. They are phenomenal. Dr. Judy Morgan, is there anything else that you want to share with us today?
Probably swimming in pools is better for our dogs. You can see the bottom, where they are, you can see what they're doing. The ocean is wonderful if you're close enough, but that has its own set of pitfalls as well. So it's a little tricky.
Yes, it is. Maybe we'll have you back on another time to talk about the other things we can talk about with water and things to stay away from. But I really appreciate your time. I want to be respectful of your time. And thank you for joining us. It is absolutely my pleasure.
Thank you very much. It was my pleasure.
Take care.
Bye-bye.